So A2M is the Alpha-2 macroglobulin. This is a very large protein that circulates in our bloodstream. It is a fabulous anti-inflammatory and really is a trap for proteases and other enzymes that are breaking down cartilage associated with the inflammatory process in osteoarthritis. That's just the normal wear and tear arthritis. So this very large molecule is circulating through our bloodstream. However, we have terrible blood flow into the joints to actually deliver this protein. The A2M protein itself acts like a Venus flytrap in that when it's inactive, it's wide open. And then when proteases and other enzymes that are going to break down the cartilage are present, it actually binds the center of that protein. It changes conformation and traps that protease into the A2M protein, and thus effectively blunting or stopping the breakdown of the joint with osteoarthritis. So with the A2M procedure, it's much like PRP, where we draw a much larger volume of blood, 150 milliliters, and we actually use the platelet poor portion of the plasma, where this large protein is floating. And then from there, we can concentrate it down, getting rid of smaller proteins that are not the A2M protein, and then have that concentrated protein and inject it back into one or multiple joints where the arthritis process is occurring.
Yeah, the A2M is another layer of natural healing. So we have PRP, ozone, prolo, cellular tissue, stem cell, stuff like that. A2M is, again, based on an expert's diagnosis of the situation. So whether you should use A2M or PRP, it's really determined on the person's advanced lab work when we run that, their current health condition, and then Dr. Miner's expertise on what should be used. It's just a layer of care, trying to pick and choose what's best for that person to heal. And sometimes the body can start to eat itself. I think we call it termites. We're referring to that with Dr. Kellen's, is that you're trying to stop that reaction from happening as well. So sometimes the body gets a little carried away with the healing process, and then that's what Dr. Ryan would determine which healing technique to use.
I think definitely in the setting of moderate and even severe arthritis, to be able to blunt that process, catch it early as well in the setting of mild, right, but to be able to blunt the process and then offer another layer of regeneration can also be very helpful.
Right. In this case, we would use diet. So we try to reduce inflammation that way, try to stop the process from occurring, but then stop it from reoccurring as well with the diet and maybe some biokinetics coaching.